Hello, good evening. How are you? How are you day? Today is Friday, the 12th of May, 2023. So how are you day now? Thank God it's Friday, and this evening I day here. I just want to follow you chats. Hmm? I'm live on Facebook, I'm live on YouTube, and I'm live on TikTok. So may we gist, if you get any comments tonight from me, I'm ready to talk to you, gist with you, answer your questions. Okay. Yeah, I'm also IB. Yeah, amicable. Amicable, how are you? I did live on TikTok. Unotina, Rachel, good evening. Amicable, how are you? Yeah, I did live on TikTok too. You don't say why I go TikTok live. So we did TikTok. Huh? I wish I could be live on Instagram at the same time, but I can't. Make I no go finish all my data. Hey, Connie, how are you? Pastor Stephen Ario, good evening. How are you? Jessica, I see you. In Kiru, I see you. How are you? Good evening, everybody. Omo, una plenty, oh. Guys on TikTok, how are you? Okay. Yes, may we gist small today. If you get any comment for me, talk to me, ask me, and let's talk. Let's go. Let's discuss. Yes, you don't say where I do live stream and I do on TikTok live. But right now, yeah, who be this? Doctor, hope you're doing well. Good evening. How are you doing? Hope all is well. Matilda, yes. Good life now, sense. Thank you. And Stephanie, is this Stephanie? Stephanie, I see you. Eric Chinedu, I see you. Good evening. How are you doing? Sandra on YouTube. So all of now we dey YouTube. If you know you can hear me on YouTube, just say hi. Tell me where you dey join me from. Cynthia, how are you? Sarah, say how you did, Doctor Fred. I did fine. No, I just did like say I no day. Today is Friday, so let me talk to you. Man, follow on our gist. Maybe gist. Share the live stream. Don't forget to send stars. People are not sending me stars. Why? The people on Facebook and YouTube are not sending me stars. Why? TikTokers, tell them why. Sarah, I did fine. Okay, so maybe gist. Who gets questions, comments? Yes, Sandra is joining me from Italy. Sandra, how is Italy? JK. Who be this? Who be JK? Who be JK? JK, how are you? Happy weekend, Kemi. Sarah, keep up the good work. Yes, so we dey try to do our best. We dey try. Yeah, okay. I'm watching you from Belgium. Okay, somebody's watching me from Belgium. Betsy, how are you? JK, we can hear you. Eric Martins, I get question today. Okay. Oh yeah, ask me your question. Ask me your question. Ask me. Let's go. Abeg, wetin dey cause constipation? The video dey my page now. Sarah, the video is on my page. Can ovarian cyst cause miscarriage? Um, uh, See, my dear, anything can cause miscarriage. You understand? But ovarian cyst will not make you get miscarriage now. Hmm? Are you related to Senator Shehu Sani? No, no. Now how? Okay, we have a question here on Facebook. It says, Doctor, I like pepper too much. Hope too much pepper no get any issue. Well, wetin I go tell you be say, if you know say you like pepper and you get ulcer, then I go advise you make you avoid pepper. But if you no get any problem at all with pepper, take your pepper because me too, I love eating pepper. I love pepper. As a matter of fact, I can't I can't eat anything with pepper no day. Yeah. Yeah. Okay. You kind of resemble. No, we no resemble. Yeah, I'm live on TikTok too. So somebody's asking me a question on TikTok. The person says, "How can I lower cholesterol?" Um, there's a question on TikTok and says, "How can I lower cholesterol?" Now, um, depending on the value of your cholesterol, uh, I don't know your name. Depending on the value of your cholesterol, if it's very very high, you would need to be on medication to take down your cholesterol. But if your cholesterol is not too high, lifestyle can help you, exercise can help you. You watch what you eat, you exercise, you'll be able to regulate or bring down the cholesterol. Now, there is something about cholesterol you need to know again. We have what we call high density lipoprotein, low density lipoprotein, high density ratio. We have a ratio and total cholesterol count. So these are important things you need to discuss with your doctor. They will help you find out. Yeah. If you're watching me on Facebook and YouTube, share this live, share the live, share the live. Let's take some questions again. What is ovarian cyst? I'm a man though. Eric, ovarian cyst is found in women. Now, women they get ovarian cyst. It affects the ovary. Hmm? We have a question on where on YouTube. We have a question on YouTube says which body cream is the best for human skin without any side effects. So, Pastor Steven, we have different types of skin. We have the oily skin, we have the dry skin, different types. And the type of cream you would use is dependent on the type of skin where you get. So, I know if it tell you, say, this is the cream you use or this type of cream you should use, you understand? I'm not an expert in that area. But what I would beg you, if you really define cream where you need to use, you go need to see experts. They will check your skin and tell you the type of cream where you go use. Yep. Um, Somebody's asking me a question. Says, can a woman with rheumatoid arthritis get pregnant and give birth to the baby without any complication? Yes, she can. Yes, 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 very possible. That's my answer for you. Yes. Okay, so we get questions here on TikTok. Una no one send me start tonight. Let's see. We have a question on TikTok. Says my ulcer is disturbing me too much. What can I use to cure it? My dear, go to the hospital. Here, we don't manage on social media. Hmm? Social media is not a place we treat people. You understand? So if you have ulcer and it's disturbing you, you have to speak with your doctor privately. We have another question on TikTok. I was told belly fat is to protect internal organs and harder to lose the fat. Is it true? Yes, it's hard to lose abdominal fat, but your organs need a certain amount of fat, but not too much. Okay, let's see. Let's see. How can I reduce ovarian cysts? My dear, you have to see a gynecologist. Let me say this quickly to everybody watching me. Very important for those where they watch me for the very first time. For the very first time, my page on social media now to teach. My page no be to prescribe medicine for anybody. My page no be to come give you lies and tell you wetin no dey the medical literature. Now, wetin I go always tell you, if you get any medical problem, I beg you in the name of God, for those that believe in God, and if you don't believe in God, whatever you believe in, go and see a doctor privately. Be very careful. I'm not going to come here to make you like me. I'm going to tell you the truth. And if you don't like me for that, no problem. If you have a problem, please speak with a medical doctor privately, not coming on social media. I have this problem. What can I take to cure it? I can't tell you anything. I can't prescribe for you here. I'm just here to teach you and advise you. Is that okay? I beg. And by the way, some people no go like them. Okay, so how can I get rid of eczema? It comes and goes like twice a year. Your hygiene, number one, your hygiene. Number two, confirm if it's eczema. And then number three, you can use antifungal creams. Okay. After surgery, appendicitis. Why do I keep having stomach pain? I don't know why. You had appendicitis, appendectomy, and you see they get pain. They're going to check you. I don't know why you they get pain. I know operate you. I don't know what they happen. So they're going to need to check you again to find out why. I have a question on Facebook. It says, how long does one who has kidney problem that undergoes dialysis for months go for transplant? I mean, someone who undergoes dialysis go for transplant. The final cure for somebody will get kidney failure. Now transplants. Now transplant. And when they do transplant, many things they involve. So the kind of lifestyle where the person will live, medications where the person will take, follow up, you understand. These are stuffs where go they important, we will determine how long the person will live. But yes, you can get your kidney transplant and you will do fine. Make una share the live stream. Oh, people know they share. They are not sharing, but they want to ask me questions. Una support now. Wow. I wish I really know those that are sharing the live stream. I swear to God. You are not sharing, but you're asking and asking. Sarah, God bless you. Thank you. Doctor, someone that have high prolactin level uh of take in, and someone with 26 is finding it difficult to get pregnant. Why? Are you sure it is because of prolactin, my dear? There are many reasons why a woman might not be able to take in, conceive. It might be hormonal, it might be ovarian, it might be structural, it might be from the partner. So you can't say because this one get 44, this one get 26, it's because of prolactin. You are not the one managing them. So there are many things involved. It might be too bad. So there are many things that can make a woman not conceive. Prolactin are just one. Many other things they involved. Unless you want to tell me that you know everything about this person. How let's see, I've answered the doc. Is it true that some dietetic medications can make one lose weight? Somebody's asking us a question here. Anu, is that your name? Anu Oludamiro. Did I get that right? So you're asking me a question if there are some medications that can make you lose weight. Okay, let me answer this. There is a medication that is on the internet, very popular, and they are telling you that if you take that medication, you will lose weight. For some people who have diabetes, people who have morbid obesity, that medication is given to them to help them manage their condition. Along the line, that medication will suppress appetite and make them lose weight. It's not for everybody. So if you are trying to lose weight and you take that medication, you might give yourself more problem. That medication must only be taken after being prescribed for you by your doctor. I dey speak Oyibo grammar, abi? No, let me go to patient. Let's see. We have another question here. I've answered you now. What's your name? Fidelia. I've answered you. Peace. How are you? I've answered you. Bowell. How are you? Thanks. Thank you for the gift. Thank you. Is it good to do IVF? Yes. If you dey try to get pregnant and they come, you dey try get belle, you and your partner, or that they try and belle no enter. They go advise you make you try to do IVF. They go advise you, your specialist. Okay. Doctor, is it possible for person to get belle? Because I saw my last period on March, and since then I didn't see. Even April, I didn't see. But this month I started seeing spotting on my pants, and I did PT, and the result is negative. Madam, so it's two ways. It's two ways. Maybe you are pregnant. Maybe you are pregnant, and then you are spotting. Maybe you're having implantation bleeding. Maybe, or maybe it's threatening miscarriage. Maybe, I'm using the word maybe, or you are not pregnant. So you are saying your period. Now, if you want to be sure, say, oh God, are they mix them together? Man, speak pigeon. Okay, if you want day sure, say you get belle, you go need to go do test. Not your PT anymore. You have to go to the hospital, make them confirm am for you. See whether you dey pregnant. Is that okay? The host has skipped my question. I'm not seeing your question. Peace. Can HPV cause infertility? HPV. No, no. Answer me now. Guy, calm down now. You just dey come now. Now so you be. Calm down, guy. You relax. I get people here with the essence. Um, he should what? He should go for any cream, written brightening cream. God forbid, though. Please don't go for any cream written brightening cream. Don't go for it. Please, if you're looking for cream that is good for you, all those cream they will tell you toning and this. Don't avoid it. Speak with experts so that you don't go and bleach your skin. I've answered you, my guy. I said no. The answer is no. What causes urine to smell in second trimester? Emmanuel, blessing. Urine should not be smelling. Urine not supposed to dey smell. So if your urine dey smell, maybe you get infection. Maybe. And if you get belle, you are pregnant and your urine is smelling, you have to discuss with your doctor. Let them find out why. They might want to carry out one test for you, few tests to know why. Maybe. Bukumi, how are you? Run away. Okay. Yes, run away from lightning. Okay, run away. Eric, yeah. Felix, I see you. Good evening. Make una share the live now. I don't know how to send stars. So, Dr. Fred, kindly put me through, please. If you want to send me star, just go to YouTube. Go to my YouTube live. Beside the comment section, you will see dollar there, dollar sign. Click on it. Send me any amount, even if it's 500 naira, even if it's $1 million, any amount. Just go to YouTube. Beside your comment, you will see one small thing there, dollar sign. Click on it. Yeah, that's better for you. Let's see. Doctor, please. Somebody says, when I wake up in the morning, I used to feel back pain and stomach pain. Back pain might be from your bed, the way you sleep, maybe. But stomach pain, I don't know why. Sometimes the way you sleep on the bed will cause you back pain and your position. But for the stomach pain, abdominal pain, I don't know why you get them. You understand? Because if you get pain, abdominal pain, you get many things where your doctor will want to find out. Your doctor. I'm using the word your doctor. They will ask you when the pain starts, the type of the pain, how the pain be, if the pain the waka, remain radiates. Will ask you how severe the pain be, waiting they make the pain come. So many things, you understand? To if you know waiting they cause your pain. So I know if you come tell you online, waiting they cause your abdominal pain. But for your back, maybe not the way you sleep, maybe not the kind of job where they do, maybe not the foam where they sleep on, Yeah. Please, doc, help me. My BP is 140/80. What should I do? Okay, listen carefully. Your BP is 140/80. The first thing I will tell you is this: here is not a clinic, It's not a clinic. 140/80. I will advise you. Make sure you repeat the BP check. Number two, get a doctor to advise you. You can try lifestyle modification to try to help you lifestyle. And if you try lifestyle and it still no work, then your doctor might want to decide on the next thing to do for you. But I beg you, we don't manage people on social media. We don't treat like this on social media. But the best advice I will give to you, try to repeat your blood. This is high. Repeat it again. Lifestyle, reduce salt, exercise, cut down on fatty food, cut down on junks. If you smoke, take alcohol, reduce it massively. We check your BP and make sure you have a doctor that would help you review your blood pressure. Very important here. Let's see. So many comments online. Oh my God. People are not even sharing the live. Doctor, is it true once a woman is up to 35, she won't be able to put to bed normal apart from true CS? It's not true, madam. It's not true. It's not true. It's not true. Full stop. Not true. What can I do to get pregnant with twins? Madam, if God give you twins, you go born twins. If God no give you twins, you no go born twins. That is number one. That is number one. If God say you go born twins, you go born twins. If God say you no go born twins, you no go born twins. Number two, you get few things where people need to know about twins. Few things. How to conceive twins, right? Yeah, how to give birth to twins. I made a video on that. It did YouTube, it did Facebook. Go and watch it. But the first thing I want to tell you be say, um, if you did your gene, if you did your family, chance they say you go fit, but you might give birth to twins. But if you know they, you if you know born twins, I go add again. Go to my YouTube channel or go to my Facebook page. Scroll through my videos. You will see the video there. Watch them. It will help you. Huh? Okay. Let's see. What is the consequence of HPV in a man? HPV can cause a lot of things. Can cause so many things. HPV can cause cancer. Your body can clear HPV too. You know, your immune system can help you, but if your immune system is down, it can affect you. So speak with a medical professional, make them check you and find out if you don't they give any problem. What causes PCOS? And the video is on my page. Please, guys, I have made so many videos. Oh, make una try watch them. Bukumi, I'm doing good. I'm fine. Can surgery be a complete cure for endometriosis? I can't give you that complete answer, my dear, because I'm not a gynecologist. Nikki Vicky, I'm sorry, my dear. I can't give you the answer because I'm not a gynecologist. So now only gyne go fit tell you the final answer. We have a question on YouTube. What general medical checkup do I need to do to prevent or detect medical issue before getting worse, and how often? Okay, what's medical checkup, right? Number one, basically for everybody, generally for everybody, you need to check your blood pressure, check your blood sugar, check your weight, check your BMI, do a full blood count, do a liver function test, do a kidney function test annually. Now, your age, depending on your age and depending on your family history, this is why you need to have a discussion with your doctor before you go for medical checkup, because your family history too go influence the kind of medical checkup where we will tell you make you go do. Example, let's say you be woman and your mama get breast cancer, or your relation, your sister get ovarian cancer, your checkup go dey different from somebody else. Do you understand? We go need to put more eye on you. And then let's say you get family member we get colorectal cancer before, and you dey like that kind of 40 and above, we go want put more eye on you. Do you understand? Or you be man that kind of 40 and above, you go want do a screening for prostate cancer. So the kind of test you go do dependent on your age, your family history, your lifestyle, basically. You understand? Yeah. Good evening. I've answered you. The video is on YouTube. My dear, go and watch my video on PCOS here. I beg, guys. See, come. I they take my time, they make videos. And I noticed something for here. Most people no one watch your video. They just want to ask you questions. So if you ask me question and I don't do the video before, the best I can do for you now to beg you, may you go watch that video. Do you understand? Make I not go get sore throat now. Abi? It makes sense, right? Nick Alio, how are you? Somebody says, if I bend down for long or at times while cooking in the kitchen, you do have waist pain. Yes, now, no, they bend down too much. Now they cause your waist pain. Full stop. The more you bend, the more you give yourself waist pain. Remember, there are so many causes of waist pain or low back pain: position, age, trauma, degenerative conditions. So if you dey bend and you dey get back pain, please, the best advice for you now, avoid that bending as much as you can, because the more you dey bend, the more you go dey get that pain. Yes. Oh my God. Somebody says, talk about stomach being hot. What do you mean by stomach being hot? Add sugar. Which one be sugar? Sugar. Okay, now I don't talk about sugar now. I mentioned sugar first. I mentioned sugar. Okay, now what? Kingsley, I mentioned sugar before. Is the first. Blood pressure, blood sugar, your weight, BMI. I mentioned that, yeah? Okay. Somebody says, is it bad to drink cold water when on your period? Did anybody say you should not drink cold water when you're on your period, madam? Look, now share the live stream. Send me stars. Yes, I know why I'm saying this, because I did see some of our celebrities when they do Facebook live. Una they send them star. Well, celebrities where they do gossip. Una they give them star. But now no one give me star today. Shebi? Okay. No problem. I understand. It's cool. So please, madam, did anybody say you shouldn't take cold water when you're on your period? As long as you are okay with it, as long as it gives you no problem, take your cold water. I don't know this discussion about cold water. It's rampant. It's everywhere. They will tell you, say, no, they drink cold water. I made a video about this. It's online. Please go and watch it. If you know that cold water is not good for you, avoid it. Leave it alone. But if you know, say, they give you any problem, drink your cold water. Na me talk am. Yes. I drink cold water. It gives me no problem. But you get people, whenever they take cold water like this, they go they cough. Leave them now, I beg. That does not make cold water bad. Now your body, how to send star? Okay, you cannot send me star on TikTok. For those on TikTok, you can't send stars. You can't send stars. I beg. Okay, they say when you're on your period, you should not take cold water and coke. Okay, let me say this. I beg, make una no vex. I've spoken with some ladies. Some ladies will tell me, say, when they're on their period, they don't take anything that has sugar. It will make the pain worse. I've spoken with another group of ladies. They will tell me that when they are on their period, they crave sugar. They take more of sugar, ice cream, fruit drink, soft drinks. That is what they need. It helps them. So what do I tell you? Please, I beg, take note of your own body and what works for you. You are the best doctor for yourself. You are the best doctor. You understand? So take note of yourself and what your body wants and what your body can adapt with and can tolerate. Is that okay? I don't dey get sore throat. Oh, my throat don't dey dry. My throat don't dey dry. What is the cause of heart failure? The video is on my page. What's your name? Pat. Pat, please go to my page and look for the video. Heart failure. I beg. Go and watch it here. Thank you very much. Make una share. Keep the good work. Somebody says, I have done hormonal profile tests. You have done HSG. Everything is okay. Just the prolactin level that is 25 and have been trying for 2 years. Love, Jessica. I want to ask you one question. Very important. I beg, respond to me. Have you seen a gynecologist? If yes, what did they tell you? Sarah, your BP is fine. The BP is okay. The BP is okay. The BP is okay. Ah, God. Yes. So, Jessica, please. You've done hormonal profile, Abi? Okay. You've done HSG. Okay. You've done prolactin. Okay. Have you seen a gynecologist? Yes or no? If yes, what did they tell you? I get 47 people on TikTok live. Yes. Okay, what did they tell you? Talk to me. What did they tell you? Quickly, talk to me. Let's see quickly. So many comments here. What is HPV? Hey God, HPV is human papilloma virus. Let me type it for you. HPV means human God, papilloma virus, papilloma, virus. Did I get it right? The spelling, okay, correct. Yeah. So HPV means my network is bad. My network they fuck up. Okay, here's it. HPV means human papilloma virus. It's a virus. We have different um, strains, different subtypes of this virus. And these subtypes of the virus, the very bad ones, can cause cancer, can cause cervical cancer, can cause anal cancer, can cause vaginal cancer, can cause penile cancer, can cause oropharyngeal cancer. How do you get this virus? Through sexual intercourse. You understand? Now, there's something about the virus. In most cases, your immune system can help you clear the virus. But in some people, when your immune system goes down, sometimes your body might not be able to clear the virus, and then it can get in there and cause you problems. So for women, we encourage you to get yourself screened. Can you talk about PCOS? There's a video on PCOS now. Ah, madam, please, yeah. I have made a video on polycystic ovarian syndrome. Go to my YouTube channel. What's your name? Austin Jang. Please, go to my YouTube channel. You will see the video there. Yeah, please. Okay. Okay, let's see. Somebody's asking us a question. Good evening. Can H. pylori cause you to be having chest pain and shaking hands sometimes? H. pylori is called Helicobacter pylori. Is known as the common cause of peptic ulcer disease. Most people have H. pylori, and yet they don't have peptic ulcer disease. Most people have this H. pylori, yet they don't have peptic ulcer disease. If you are having chest pain, you are having shaking hands, it's important we know why. Maybe your chest pain might be due to gastritis. Maybe it might be due to problem from your ribs, costochondritis. Maybe it might be from the heart. Maybe it might be from your muscle. It might be a referred pain. So I don't know if your pain is caused by H. pylori. And H. pylori will not make you have shaky hands. Yeah, please. Uh, what is the benefit of water fasting? I can't remember now. It's not in my head. No vex. Yeah. Oh my God. I want to end the live stream. I don't tire. Please, I've been having smelly discharge the last week. I just found out that I am pregnant and I saw my period last month. Congratulations, ma. Geraldine, you are pregnant. Congrats. Congrats. Now, the next thing I could tell you, very important, madam, go to the hospital, go and see a doctor. I'm not saying that um, there's a problem right now, but you are pregnant, Abby, and you know you are pregnant, and you are having smelly discharge. Please go and see a medical doctor. I did not say you should go to the chemist. I didn't say you should go to the pharmacy. Please go to the hospital and speak with a doctor. Yeah? Neka, Neka, how are you? What causes quick ejaculation? There's a video on that on my page. There's a video, my dear. There's a video on that. Please watch it. I don't tire. See, come. You know what they tire me? Make I tell you. As they do this live stream, I was even say when they send me stars like this, now they send me stars, and they send me flower like this. You could encourage me. But guess what? As they talk to you, so my head, I get small headache. I'm not doing follow for follow. I'm not doing gossip gist. So so when you do gossip, they crack your brain. But I go beg you to share. I go beg you to invite your friends. I go beg everything. Go see do am. I'm not Jesus Christ, right? I'm a bloody human being trying to do the little I can. You understand? So it would be nice if as I try little, you say if you did try by sharing the life, by at least inviting your friends. Yeah, please. Somebody says, I was told drinking of cold water when on your period can cause fibroid later. Not true, madam. Not true. Please, not true. I don't know where you got that from. But what causes fibroid is not cold water. Hmm? Oh God. Fibroid is what we call is a benign growth in the uterus. The muscle of your uterine wall will start to dey increase, those they grow on their own. And they feed on hormone. They are common in women in their reproductive age. Not be cold water they cause fibroid. I don't know who tell you that one, but that is not what causes fibroid. You understand? And then so many women get fibroid self, they don't know, and they are living very well. They are doing okay. They don't marry, they don't born. Uh, let's see. I'm about ending the live stream. Now, true say eating of catfish fit make prolactin high. Where did you get that from again? Where you dey hear this kind of comments? Eating of catfish they make prolactin high. I never hear that one though. Okay, you met a gynecologist. She recommended okay four capsules, and I have taken eight, taking it and still the same thing. When did you take it? And when have you gone back to see the doctor? Hmm? Okay, let's see. Good evening. I'm watching from Abuja. Perpetual. Please, I have someone having pain in his vein between his shoulder and neck. What is the cause and remedy? So I don't think what you are talking about is vein. Is it vein? I don't know if it's vein. If it's vein or if it's a nerve problem. But maybe the person don't do something where they very hard, eh? Hard labor, hard work. We don't force that area to be cause pain. You understand? So I don't know which they cause them. I can't even lie to you online and tell you I know what it is. You know why? I don't know this person. I don't know anything about the person, and I cannot come online and start opening my mouth to talk rubbish as if I'm a magician. Medicine is not magic. Medicine is a process. So you need to see your patients. You need to talk with your patients. You need to examine your patients to really know what is going on. So, Jude, there's no way I'm going to tell you the thing where they do now from the village now because that's rubbish. You don't do that in medicine. Mary, Mary, you. Just get out here. You get out here. You, Mary, you. Okay. Dog, answer my question on YouTube. Chidubem, I'm not seeing your question, I beg. Oh, I have sent you star, but you didn't say anything. If I've done it well or not. No, that is not the kind of star, my dear. Sorry. Mary Juliet, how are you? Mary, I'm fine. Oh, how are you now? Mary on TikTok. I'm talking to you. Mary Juliet on Facebook. Good evening. Somebody says, answer my question. I'm not seeing your question, Eric. Oh my God. What causes rashes that always come up even after medication? Rashes that comes up after medication. This one after medication. Is it any medication or certain medication? Number one. Number two, rash now very, very, very stubborn thing. So this your rash, no dey clear. A rash after medication or before medication. I don't know if you understand. Okay, guys, I don't try. I don't tire. I have to go now. I beg. I really, 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 really have to go. I beg, I beg, I beg, I beg, I beg, I beg. Um, I swear I don't tire. Um, um, Somebody's asking us a question. Let's see. What causes bloating, indigestion, maybe excess over, maybe too much, and microorganisms in the GIT or indigestion? Do you understand? The kind of food you eat. How can someone overcome addiction, drug addiction? You go need to seek help. You go for rehabilitation. mm, to combat addiction. You go need to seek help. What is the benefit of water fasting? The benefit of water fasting, benefit of water fasting. Ah, what do you mean by water fasting? Water fasting. I know that if you fast, it can help you detox. Yes, it can help your body break down excessive amount of fats. Do you understand? Uh, it can help you clear your guts. Can help you keep your gut clean. Yeah, basically does. I don't know. I can't remember much, but maybe I will do my research again. How can somebody stop thinking too much? You have to know why you they think too much. Me, I dey think also. I dey think well, but ma tell you wetin I dey think. So I dey think about my job. I dey think about my videos where I wan record. I dey think about my programs on radio. I dey think about programs on social media. I dey think about my studies. I dey think about life generally. Now it's normal to think, but when the thinking can they affect your daily activity, the thinking they make you get anxiety, they get palpitation, they affect your sleep, they affect your blood pressure, they affect your relationship. That one don't pass. Be careful. You gonna need to seek help. Yeah, may they help you find out what they cause them. Now the thinking if it be a symptom of something else, if it be a symptom of anxiety disorder or depression. Do you understand? So you gonna need to seek help if your thinking they affect your normal daily activities. Yes, I don't try. I don't tire. I think I have to go now. I know most people on social media now gossip with they like. Uh-huh. Now gossip gist we they like. Because if now gossip I they do for here go don't full well. Now before I round up, I want to say this very, very important. I beg. Please, guys, please. I don't do private chats. I know the private chat anybody on social media. Um, I don't do it. So if you private chat me, I'm sorry. I know they respond. You know why? I don't stop them. Hmm? I've stopped a long time and I'm not going to go back to that. It they bring a whole lot of see finish. It they bring a whole lot of stuff where I don't want. So I don't stop to the private chat. So in case you they private chat me here and I no respond to you, no vex. I don't do that. Number two is that I don't give my number on social media. I don't appreciate people calling me. I love my privacy. Do you understand? I am not online to be giving my number, calling me. I want to talk to you. No, I don't do that. The only thing I do online now, I come here, I teach you, and I disappear. I try my best to give you proof and facts in medicine, not what is from my hair like that. So in case you won't call me or you won't private chat me, I'm sorry. I no go do and I no give my number. But if you feel that you must talk to me, you must talk to me, you really want to talk to me, there's a link on my page. Click on that link. You will book for a consultation and you will pay for that consultation. Do you understand? If you are here and you want to talk to me privately, there's a link on my page. Click on that link, book for a consultation. Somebody will chat up with you and you will pay for that private consultation. Other than that, I know they give my time to people to they call me because I'm very, very busy and I love my private space and I'm not going to trade it for anything. So no vex, I beg. No vex. In case you did here and you did watch me and you did try to private chat me for a long time and I'm not respond, I'm sorry. No vex. It's my own principle and I'm not going to go back to it. I beg you, please understand. Good life, na sense. Yeah. Thank you, and God bless you. I have to go now. I don't tire. My throat don't dry. Where and how can one get rehabilitation over drug addiction? Hillary, where are you based? Where are you based? Quickly, where are you based? Where are you based? So that let me find out. Talk to me quickly. Where are you based? Are you in Nigeria? where in Nigeria are you based? If you are in Nigeria, we have rehabilitative centers that can help you. If now you in Abuja, okay, do me a favor. Today is Friday. I will try find out. When I come online again, maybe tomorrow, remind me, ask me. I will try. So this night, make I ask around if e day for Abuja. If e day, I will tell you. Hmm? Thank you. Remember, guys, good life, good life nonsense. Tracy, I see you. So take care, everybody, and have a wonderful night. Bye bye.